Welcome to another episode of No Spin Live. Today we are all quarantined basically into our homes in different cities. We have a couple of guests with us today. We have Dr. Pat McGuire from St. Louis, Missouri, and Dr. Raj Mohan from Arlington, Dallas area, Texas. Welcome, both of you.
Thank you.
We basically seen in the last couple of months, first a sort of a voluntary slowdown of our practices, and then actually a mandated shutdown of our practices. In the state of New Jersey, where I am, they basically have prohibited any elective cosmetic consults and procedures from being performed, sort of categorizing us as if we were salons, and in the same spectrum as some of the nail salons and med spas. And in each of your states there are sort of different guidelines. But I'm going to go first to Raj. If you can tell us a little bit. Now you're the newest. Pat and I have been in practice for a long time, but you're pretty new to practice. Can you tell us a little bit about your staff, where you were, how many staff members you had, and then what happened gradually and where you are now?
Sure. I feel I offer a different perspective. I just started my own solo practice in December after I completed my boards. And I guess I'm a rare breed now because most people are either employed or in academic settings, but I've always wanted to be in private practice. So it's been an interesting time period. I've been transitioning to ramping up and building a new practice and opening a new office. And this whole thing occurred and kind of put a lot of things on hold. But, where I am, I'm currently renovating a new office space, and I have an office manager that I hired. Once I open up, I'm going to hire more staff, a medical assistant, and a front desk person. I think the advantage for me, because I'm starting out, I don't have a very high overhead. I'm not that busy, so I'm able to sort of weather the storm. But, things for me are kind of on hold. A lot of the things I need, a lot of the vendors I'm working with, they've laid off employees, or just getting a lot of things done is taking a lot more time than I expected.
Okay.
And then one more comment, adding in the state of Texas, sort of a moving target in terms of the dates, but until April 21st, plastic surgeons are not allowed to do any elective or cosmetic surgery procedures. So a lot of my procedures have been canceled or have been put on hold.
And Pat, what's going on in your office? You're a little bit of a bigger office and certainly have been around for close to 30 years like me.
Yeah, we have three surgeons in our office. We have 2 nurse injectors. We have 3 estheticians in the office. And we furloughed all but our office manager, 1 patient coordinator, and 1 RN. We are seeing patients, post-op patients and emergency patients. One of my partners had to do a surgery, has a surgery scheduled for tomorrow. So there are some things going on. We are doing virtual consults in the office as well. And we've talked to our building about our rent payments being delayed. We're adding it on to the end of our lease and negotiating things with it. Fortunately, we do have mature practices, but my senior partner and I, the bad thing was this is the busiest time of the year, and I've canceled a lot of surgery, and we have patients begging us to get on the schedule because they're not working, and they think that their surgery is essential. Missouri does allow surgery that is essential. I work at a freestanding surgery center, and our center is open 3 days a week, but only for emergencies. They're doing broken bones, hematoma. They are doing some lithotripsy if there's obstruction, renal obstruction. They're doing those types of procedures now, but they define urgent or emergent as something that will either, if it doesn't happen, result in the death or some sort of permanent injury to a patient had it not been performed.
Right. And I'm in a similar situation. So basically, I'll just tell you, I've been in practice for almost 28 years, 29 years. I have a very small staff. I actually had one girl leave recently. And so I have a small staff, and I'm weathering the storm, but it's the same thing as Pat. I had our busiest time of year, being in the Northeast or up in the Midwest, wherever you are. The winter is when everybody wants to get stuff done, and we were booked heavily, and having to cancel all those patients has been an issue. First, logistically, just putting them on hold. And now if we're trying to build up, and we're going to get into the topic of virtual very quickly, but getting into sort of seeing new patients, the concept of where are we going to put these people? And again, I work at a freestanding surgery center, and there are a big orthopedic group and a pain group, and we're all going to be fighting for days. We're talking about now working in the evenings and adding Saturdays to our surgery schedule. That's if the state of New Jersey doesn't confiscate all of our ventilators. So we're kind of on hold. So let me ask you a little bit about, Raj, have you, before this shutdown, did you think about doing virtual consultations? Was it something that you had in your mind that you would include in your practice, or was it something that you just thought was for only very popular surgeons who brought their patients in from around the world? What were your thoughts on virtual before this occurred?
It's a good question. I think, well, I did a fellowship in Dallas, with ASAP's fellowship at Dallas Plastic Surgery Institute with Rod Rorick, and I know he did a lot of virtual consultations, and I think because, he's pretty savvy with technology, and, so many of us use phones for everything. I first started with a lot of my follow-ups. I would always talk to them through FaceTime or Skype, for example, and then as I started practice, I had a couple of patients from residency from out of the state and a couple of patients from afar who happened to find out about me, who would call me, and I did do virtual consults through FaceTime or Skype, but it wasn't that, it was pretty infrequent. I know that a couple of my colleagues do it quite a lot more often. So it's something I'm familiar with, but I guess what I had to get up to speed with, luckily my wife is an attorney that does healthcare law. She works for Bertadotto. So she told me all the guidelines, which apps you can use, which ones you can't use, what consents you need. So she taught me everything, and I wasn't really employing all that in the past.
Right. We're going to get into that in a little second, because we're going to outline that really carefully for patients who might be watching this, and patients who are considering looking for a plastic surgeon who's doing virtual consultations. Pat, can you tell me a little bit about how you transitioned? Because I know we used to hold off because we felt like as old-time plastic surgeons, we needed to examine that patient. But tell me how you transitioned so quickly within the last 2 weeks, and what you do to screen your patients, who screens your patients, and what you do as far as photography, because that's really key to plastic surgery planning.
Yeah, what we did as soon as all this started, I had not done virtual consults before. It was something that we had thought of doing in the past, but never kind of got around to it. It had been so busy the last few months that now we have time to figure this stuff out. So we are using Zoom. It's a platform, the professional level, which is HIPAA compliant. So we evaluate these patients just like we do any new patient that calls in. The patient coordinators will take the call, and then they will evaluate the patient using this, what we call the green sheet, where they get a history. What is it the patient wants? What are their goals? And they go over basic things with them. Make sure their BMI isn't 50, where they wouldn't be a candidate to have surgery at our surgery center. They go over, they give them a range of financial costs, so the patient knows that, we don't have somebody come in who thought the total cost of their breast augmentation was going to be $500. So we do the same thing on our virtual consults. We do not charge for virtual consults. Everybody's different on that, although we were thinking about it because we've had a few of them not show up, so maybe they're not taking it as seriously. So it's something we will consider. Then a day or two before the virtual consult, we have my nurse will call the patient and go over our medical history sheet just like they do as well. We want to be sure they're not on Coumadin, they don't have some significant medical issue that would not allow them to have surgery. Once all of that has gone through, the consult is scheduled, we ask the patient to send us their photos. We send them the ASPS photographic guidelines. to the patient, tell them to try and recreate this. We realize this is not going to be the picture we're going to use in our permanent record for surgery. They'll come in before you do a consult. We're going to have the patient come into the office anyway, but we have them and it gives you a good idea. To some degree, I like it better than a regular consult because you're actually seeing the patient before you examine them. So you know what to tell them or whether you can or can't do what it is they want, and give them a much more specific idea of what procedure they might need. In the end, I actually like the virtual consults. The patients are very appreciative. I think it's a good screening tool, but I still plan to see every patient in the office. But I see a lot of patients from out of town, and those patients have been really happy to have this option, but rather than having to come in if they live a long distance away.
Yeah, that's one of the things I think is fascinating, is that although we all kind of thought about virtual consultations, to actually put the steps in place. And one of the things I think prohibited us from freely contacting a lot of patients who may not be so internet savvy that they can get onto different platforms was that the Department of Health and Human Services just relaxed the HIPAA guidelines. So in other words, they didn't truly relax the guidelines, but they relaxed enforcement. So they're not really enforcing all of those guidelines during this COVID crisis, they're saying. Whether or not they're going to come back up and put some of those guidelines back in place and really restrict the platforms after this is over is a different story. So that's part one, is that they have relaxed the different guidelines, the HIPAA guidelines. The second part is the need to put in a really good informed consent. So if a patient were to go to a virtual site, and I searched a few of them, I was trying to find some crazy ones, and I found a couple with some from Medispas and derms that are just have been doing this for a while. There was no photographic, consent. There was no consent about the platform. And one of the things that we saw is that what the FDA and the Department of Health and Human Services did is they basically said that you can use many different platforms, but here are a few that you can't use. And the ones that they basically say that you shouldn't be using are Twitter, or I think it's TikTok. And I said to I told my daughter TikTok, and she said, Mom, I'm 26 years old and I'm too old for TikTok. But those are some of the platforms that are out there. So those are the ones you really can't use. But the basic Skype, Apple's FaceTime, those are pretty good. One of the things as plastic surgeons that makes us a little bit different is that our aesthetic society went further and kind of generated an informed consent. And that informed consent lets the patient know that that there is the potential that no matter what secure platform we think we're using, there is the potential for hackers to get in there. So you have to sign an informed consent from both sides. And the other thing too is that, Dr. McGuire, Pat gave me hers and her consent, and basically that neither party is videotaping or recording it, because I really wouldn't want a patient to be recording every word I said, nor would I want to be recording them. So that's some of the things that are in an informed consent. But those are the basics for patients who are looking for a plastic surgeon, an informed consent, understanding what platforms to be on, standardized photography, which you have to send to us so that we can pre-screen you. One of the things is, I can ask you, Raj, do you charge? I mean, I'm charging for consults and they're paying. The patients that are serious, I put it towards their surgical procedure.
Right.
So it's just a small amount, but it basically, again, is another filter. If I'm going to sit there for 40 minutes of my time and schedule that patient, especially driving in from home now and all of that, do you charge? Are you going to charge patients for virtual consultations, Raj?
For virtual consults, no, I don't. I haven't been charging. What I've been telling them, although I've been following all these things because I've started using the ASAP's consent, I'm telling them right now, since it's a temporary period, I'm offering the virtual consults, but we can do a more lengthy, involved consultation in person once all these restrictions are lifted. So I have not been charging them, and I think it's been good right now because it just, the patients that were supposed to see me, at least they get an idea, they get to meet me, they get an idea of what the procedures are and what I recommend, and it just gives them some time to think about it.
Yeah, I think it's good because it keeps them interested. The concern we have is we have a lot of patients still on the books, and we've been just moving them. Each week we have to cancel. We've been moving things off. Although we're getting close enough to summer, we have some people now putting their surgeries off until fall. But it keeps them interested. It keeps a way to to stay in contact with them. And I think once you have a semi face-to-face meeting, they're more likely to come back to you.
I know. I feel the same way as Pat. I couldn't have had a more relaxed consultation with a patient than I did last week. It was scheduled. She was smart. She was able to get onto the Zoom meeting. She was prepared. And I actually took my laptop around my exam room, showing her the implants, showing her little charts. I have a little model, and I was showing her how we measure, showing her the different feels of the different devices, different choices. I could open up my drawer with 1,000 implants in it, turn my camera right down into there. So it was very relaxed, and nobody knocking on the door telling me I was 20 minutes behind, you know, and I didn't have to worry about the patient getting there on time. We turned on the meeting and they were there. So it was kind of a nice meeting together. I had a little follow-up question. So we talked a little about where everybody operates, and Pat, you talked a little bit about scheduling. Have you had any patients asking for refunds and just flat out saying, I lost my job, things aren't where they're supposed to be? And do you see that following us into the spring and into the summer and fall? Pat?
I've had one patient ask for a refund. Everyone else so far has not. They want to keep it there. I had a patient that I did a virtual consult yesterday that wants to start making payments now and wants to have surgery in 6 months. So there are some patients, you know, making plans for this. I think when the economic impact of this hits people, of what it really is going to be, we may see more of that. Now, the other side of this that I've heard other plastic surgeons say, some of these patients are making more money on the unemployment than they were before. Yeah. So we may see an uptick of some patients wanting to have surgery that wouldn't have otherwise. But I think we are going to see some changes when people realize that the economic impact of this is not just going to be, hopefully we open up again soon. But I think we still don't know where everything is going.
Raj, what about you? Have any patients postponed their surgery? Well, obviously everybody's postponing it, but anybody cancel on you or anything like that?
No, nobody's canceled. I mean, they've all stated that they still want it done. It's just a little challenging for them because they either wanted something done in April or May. Now they have to push it off. The interesting thing is we did have a few that wanted to place a deposit now. They didn't want to lose their spot. But I said, you know what, just wait for all this to settle down before you start, you know, putting down a deposit or putting any money towards your surgery.
And the patients have been great. They've all been very understanding. Mm-hmm. We had a couple patients who did think their Botox should be an essential service. But other than that, our patients have been very understanding. A lot of them are really disappointed because they're off work. They want to have surgery. But I've been very impressed with how well this has been handled. And they know it's not our fault, that we would love to be still doing their surgery, but we don't have a choice.
Yeah, I found the same thing. Most of the patients, I had a few little glitches with patients who had put their payments on Care Credit because Care Credit, you know, issuing a refund to people, putting off their first payments. So we're negotiating with Care Credit to help those patients. And sometimes the facility we have to pay that initial payment again. So we may have to eat some of that. But again, just not to lose the patients, holding on to them, sending out emails to them, letting them know that I haven't moved people out of their dates.
Right.
We're just adding everybody else in.
Yeah. That's exactly. We can't let the people we schedule they're scheduled for the end of the month or the first week of May. We've kept them on those dates, but we've also given them options for other dates later on.
Yep. Okay. So I guess we're going to have to wait and see what happens with our staff and with everybody getting back to work. And I have this feeling that they're saying about opening up different parts of the country at different times. So we may see a little bit of people flocking to peaceful St. Louis from New Jersey, which is still shut down, you know, and if people are going to be traveling from state to state to get plastic surgery, whoever opens up first. So we'll have to wait and see. But thanks for being with us. And again, thank you for watching another episode of No Spin Live.